All mobility is intended for soft tissues, which is basically everything that's not bone: the muscles, the ligaments, the tendons, and the capsules. Simply stretching the muscles actually produces less of a degree of change than mobilizing a restricted capsule, which is a huge determiner of joint function. I tell every patient that mobile hips are a key to a life free of back pain. Since the hip capsule is a dense fibrous tissue without contractile components, it requires a special kind of prolonged and positional stretch to produce that change. Consider the band as a sort of force multiplier. The more stretches you can incorporate with a band, the more profound stretching you could do. Hold all capsular stretches at least 2 minutes. The goal with these protocols is to reposition the head of the femur inside of the socket to provide the greatest range and ease of movement. Prolonged sitting postures will position the head of the femur too far forward in the capsule. Consequences include compromising the back and lumbar discs, as well as hip pain or impingement. The hip flexor protocols will fix the anterior capsule. The following protocols will assist with the rest of the hip capsule mobilization. While there are no trigger points relating to hip capsule problems, pain in the front of the hip, especially at the bottom of a squat, is a good clue. A dumping of lordosis or butt wink is another big clue. This is what this looks like. To test the stiffness in the capsule, place one ankle above the opposite knee and let the tested knee fall towards the table. You should be able to open up the hip so the leg is nearly parallel to the table. A positive test for hip capsule problems will be feeling a restriction at the hip or a pinching sensation or pain in the hip itself during the test. This protocol is best for those who have hip pain at the very bottom of a squat or have the dreaded butt wink squat, where the low back uncoils and the butt turns to the ground at the bottom of a squat. The uncoiling of the lumbar spine in this manner will put too much pressure on the front of the lumbar discs, which research says can weaken the outer layers of the discs and make disc herniation much more likely. The cause of this uncoiling is that the ball of the hip is too far forward in the hip socket, causing limited flexion during squatting, instead requiring the lumbar to flex instead. These moves will help reset this. You'll need a medium to heavy band for this. Attach the band to an upright at knee height or below. Step in with one leg, turn away from the upright, and take a few giant steps forward. Kneel on the banded knee and extend your free leg behind you. Make sure the band is high in the crease of the hip. Try to bring your chest to your knee, ensuring that the hip angle between the leg and torso is as small as possible. Keep your butt high in the air. Hold for 2 minutes to create a change in these tough capsular fibers. The hips will benefit by adding an additional stress vector to free up other portions of the capsule. To do so, turn your body between 45 and 90 degrees away from the rig. Now fully externally rotate the banded leg and block the ankle with the opposite knee. Then do as you did before, sinking your chest downwards towards the knee. Hold for an additional 2 minutes. When you use bands, there must be considerable stretch in them for a therapeutic difference to be made. Know that a little bit of pain is a normal part of the process. Be sure to do an air squat before and afterwards to feel the huge difference. This protocol will encourage healthy hip flexion and external rotation necessary for proper movement during a squat. Also, this technique should ideally be done banded, but may be done without, as in the Spider-Man stretch. Both will be shown. First for the stretch. Get into a lunge position. Lean forward and place your hands in front of you. One hand will be just inside the forward foot. Sink the hips forward while using the arm close to the leg to push the leg outwards. First do this with the elbow and then eventually with the hand for a deeper stretch. And now for the band. Grab a medium band and set up as you did above, except with the band loop several inches above the knee, pulling your leg outwards. The leg should be perpendicular to where the band is attached. Hold the position for 2 minutes. Be sure to do an air squat before and afterwards to feel the huge difference. This protocol is another excellent way to help hip problems of all kinds and even help eliminate disc pain in the low back. If it is disc pain, you'll want to make sure that you check on page 56 to make sure the problem isn't serious. You'll need a medium-heavy band for this protocol. Attach the band to an upright at knee height or below. Grab a foam roller to help take gravity out of the system. Take several steps backwards and sit on the ground. Position the band so the end is wrapped under the heel with the lines crisscrossing over the top of the foot. Position the foam roller underneath the ankle where it's comfortable. Lay back and relax the hip and back. Hold this stretch for 2 minutes. If you notice that pain or symptoms get worse with this, discontinue the protocol. Hi, Dr. Nick here from MobilityWODShop.com. I highly recommend you grab a nice mobility band from MobilityWODShop to get full mobilization of this area. So click the link that just popped up on your screen and you'll be well on your way to the mobility you've always wanted. Grab your MobilityWODShop mobility bands today. They're high quality and you won't regret it.